The method of abortion from 15 weeks on, depending on which abortion clinic a woman goes to, but specifically at Orlando Women's Center and EPOC and all of Pendergraft's abortion clinics, the method is labor and delivery. Now the women, they wouldn't be aware of this, although it's on Pendergraft's website saying that this is true. When it's time for the woman to give birth, she's instructed to sit on the toilet and push. A lot of people will be surprised about that. There's a couple of reasons for that. One is that everything will be caught and contained in one place. It decreases the amount of work for the abortion clinic worker. These abortions and these deliveries are not usually assisted by a physician. They usually have women helping. They're not even nurses. They're very low-level medical. But if a woman sits on a toilet and delivers her baby, then her child is delivered, the blood, the amniotic fluid, and the placenta all go into one convenient place. So it keeps the clinic worker from having to clean up a mess. The toilet that the women deliver the babies into for late-term abortions is a regular toilet. It's used to go to the bathroom in the abortion clinic. It's just a regular toilet. And I know a lot of people have a hard time believing that that's true. And I've had people question that fact. But I've interviewed mothers, and I have a videotaped interview of a mother describing the fact that she was sitting on a toilet. The process of labor and delivery abortion, which is called a prostaglandin abortion, means that you can have a live birth. They are actually much more common than people think. And if a child is able to be born outside of an abortion clinic, he or she has a much greater chance of survival. But if she's born inside an abortion clinic, the clinic workers are used to and even trained to allow the infant to die. Although President Bush signed an act called the Born Alive Infant Protection Act, which gave humanity to the preborn child, especially those who were aborted, it afforded them the right to be given the same medical care that a wanted child would receive in the event that they were born alive as a result of an abortion. So naturally, we have this act because it was needed, because infants were being born alive as a result of abortion. And the president, as well as probably most Americans, their conscience would tell them that when a person is alive, born alive, then you need to treat them with respect and dignity just as any other human person. So even though that act was in place, it's very routine for abortion clinics to have to deal with infants who survive, especially a labor and delivery abortion. It's very common. I've ran into patients outside the abortion clinic who've told me they saw their infants born alive. The clinic workers of James Pendergraft themselves have testified to me and also to others that they have seen infants born alive in James Pendergraft's abortion clinics.